Do you want to know exactly how to take care of your skin after undergoing CO2 laser treatment around the eyes? In this video, I am going to give you the exact step-by-step regimen for the first month after your procedure. So make sure to watch until the end so you don't miss anything. And just a quick reminder, this is general guidance. Follow your provider's specific recommendations. After a CO2 laser treatment around the eyes, your skin has undergone a controlled injury, and it now needs to heal. The key is to heal your skin properly so it can recover optimally from this injury. That means less scarring, faster healing, and best cosmetic outcomes. That's why it's important to follow the proper post-treatment protocol. Otherwise, you could be potentially hurting your results and setting yourself up for poor healing. So let's get started. We will cover 3 main sections. So let's start with immediate aftercare. The first 3 days after your CO2 laser treatment. Your skin will be fresh from the laser and probably feel a bit uncomfortable. It might feel warm, sore, red, swollen, all of the above, or even none of these. Everybody reacts differently to the CO2 laser. In fact, some people say they don't feel anything at all after the treatment. Regardless of how you feel, there are some basic guidelines to help promote optimal healing. The first thing you need to know is no washing with soap or water on your face or the treatment area for the first 24 hours after your procedure. Instead, you can use a sterile saline solution, something like this one by Ocean Spray, to moisten a cotton pad or gauze and gently clean the surface. Another option is a diluted vinegar soak. You can add 1 teaspoon of white vinegar to 1 cup of water, moisten a gauze pad in it, and gently wipe down your face. Again, avoid getting any liquid near your eyes and then pat dry with either sterile gauze or a clean tissue. The reason we recommend these types of soaks is because they help remove any debris while keeping your skin at an optimal pH level. Normal soap can disrupt this pH level, leading to irritation and dryness. And always remember to avoid scrubbing your skin, especially immediately after treatment. Be gentle and don't use any abrasive cloths or pads, whether you have a saline soak or vinegar soak handy. Let's move on to moisturizing. Right after your CO2 laser treatment, your skin will likely feel tight, dry, and uncomfortable. And it might even appear shiny. This is due to the loss of moisture from the upper layers of the skin. To combat this, you're going to want to apply an occlusive ointment like Aquaphor or Vaseline. These ointments create a protective barrier on top of your skin, preventing water loss and helping to keep your skin hydrated. Applying a thick layer is key. Make sure to coat the affected area generously. This will also help prevent scabbing. Scabs form when the skin dries out, and it can cause issues during the healing process. This leads to the next point. You need to stay completely out of the sun for the first week after your CO2 laser treatment. Even indirect sunlight coming through indoor windows, UV exposure, even without tanning, can damage the new collagen being formed in the lower dermis and hinder the healing process. Protect your skin by staying indoors and wearing sunglasses and wide-brimmed hats if you must go outside. Now, all of these tips cover immediate aftercare for the first 3 days. Let me know in the comments if you have had a CO2 laser treatment before. Tell us about your experience and what was recommended by your doctor. Next, let's discuss what you need to do from day 4 to 7 after CO2 laser resurfacing. By this time, the initial healing phase is still ongoing. Your skin may start to peel, but underneath the skin, new pink skin is starting to emerge. You might think picking the dead skin would speed up the process, but it can lead to further complications and issues during the healing phase. Plus, it can introduce bacteria into the open wounds. If you can, try to avoid picking or scrubbing off the dead skin. Instead, let it peel off naturally. And you're still going to continue using saline or vinegar soaks to clean your skin and ointments to hydrate it. And here's an important tip. If you notice that your skin is not healing properly, or you see signs of infection such as pus, increased redness, swelling, or fever, don't hesitate to reach out to your doctor immediately. Next, let's talk about what you can do once the early healing phase is over. Generally speaking, this happens within 2 weeks after your CO2 laser treatment. If everything is going well, meaning your skin is fully closed and there's no crusting or raw areas, you can switch to a more gentle cleanser like Cetaphil. If your skin is still feeling sensitive, you can stick with saline or vinegar soaks for a few more days. It's important to clean the area before applying any treatments or products. Then you can apply broad-spectrum sunscreen SPF 50+. You're going to want to apply this every single day. Even if you don't see clouds or feel rain, harmful UV rays can still penetrate through and affect your healing skin. Remember, no tanning beds either. Sunscreen protects you from both UVA and UVB radiation. UVA rays cause skin aging and are present on cloudy days. UVB rays cause sunburn and are mostly present on sunny days, so you need to protect your skin daily. You can add a hydrating serum like hyaluronic acid if your skin tolerates it. Hyaluronic acid helps to draw moisture from the environment onto your skin. Niacinamide is another product that can be helpful in repairing the skin barrier and reducing hyperpigmentation. If you've been using it in your skincare routine already, you can resume it again. Although it's generally fine to start using these active ingredients earlier. If your skin is not sensitive, I personally like to wait until my skin is fully healed and I can tolerate them better. This is where things can get tricky. When can we start using retinol again after CO2 laser resurfacing? Retinol is an excellent anti-aging ingredient, but it can also be irritating, especially after undergoing a procedure like CO2 laser. Most dermatologists recommend waiting at least 3 to 4 weeks after the CO2 laser before restarting retinol under the eyes. However, even if you've reached the 4-week mark, you should only resume retinol if the following 3 conditions are met. No. 1, your skin is fully healed. This means no redness, no peeling, and no open areas. No. 2, you're not experiencing any sensitivity or irritation. And number 3, you're not using any other potentially irritating products or treatments. Even if your skin is healed, you still might want to ease into the use of retinol because it can be very potent. Start with a low concentration like 0.25% retinol and use it every 3rd night. You can mix it with a moisturizer to dilute it further or use a retinol buffer if it's available. If irritation occurs, dial back the frequency or strength of the retinol. Some people find it helpful to wait until their skin is fully used to retinol again, before increasing the frequency to every other day and then eventually daily. Always apply sunscreen the next morning after using retinol, especially on laser-treated skin. Now, if you don't remember, this is not an exhaustive list of skincare ingredients and treatments. We also didn't cover lasers, microneedling, or chemical peels. And those are actually a huge topic on their own. If you're interested, comment below and I can make a video specifically on that. Let's wrap this up with a brief timeline summarizing the key points we've discussed today. Time after CO2 laser skin condition. What to do, days 0 to 3. Swelling, redness, saline, vinegar soaks, occlusive ointment. Days 4 to 7. Peeling, pink skin, emerging. Gentle cleansing, continue ointment. Moisturizer. Week 2. Pink intact skin. Switch to bland moisturizers, SPF 50+. Week 3 to 4. Skin stronger, redness fading. Introduce gentle actives niacinamide. Week 4, near normal skin. Optional, resume retinol slowly. Keep in mind, this is a general guideline. Your provider might have given you a different set of instructions, so make sure you follow their advice. Also, if you're planning to wear makeup, wait until your skin is fully healed. Typically, this takes about 10 to 14 days. Avoid scrubbing your skin, especially with washcloths. If you notice any signs of infection, such as pus, increased redness, swelling, fever, contact your healthcare provider. Thank you for watching. I hope this video was helpful. If you have any questions or concerns, please comment below and I will get back to you. Wishing you happy and healthy skin.